Hi, my name is Jared Gollob. I'm Chief Medical Officer at Kymera Therapeutics. Yeah, I think early improvement, whether it was in the EASI score, which is a measure of disease burden, skin lesion burden, or in pruritus, which is a measure of symptoms, tells us that the drug is able to start to affect the disease, early rather than late. So we know that when we give a dose of our drug, even after the first dose, within 4 to 8 hours after that dose, we get full degradation of our target, in the blood and in this, which is very important. It tells us that we have a drug that works quickly. And so to then be able to show on top of that that we're seeing effects on itch and on skin lesion burden as early as 1 to 2 weeks following the initiation of therapy. Typically, we see those effects as early as even 1 week after starting therapy. Just tells us that this is a drug where patients can start to see and feel improvement relatively soon after treatment. The fact that it didn't plateau over the 4 week period, meaning the response keeps going, getting deeper and deeper as you go from week 1 to week 4, tells us that, if we had treated beyond 4 weeks, which is what we'll do, are currently doing in our phase 2 study, treating for 16 weeks, then even beyond 16 weeks, for an additional year on our open label extension study, that we would expect with continued treatment beyond 4 weeks, we should see further deepening of the response beyond what we saw even at 4 weeks. That's what we meant by not plateauing. How long will it take before we see a plateau in response to our drug? We'll probably start to learn that from our ongoing phase 2b study. Well, I think the phase 2b study is an important trial because we call it a dose range finding study, where we're looking at three different dose levels of our drug, of KT-621, and comparing that to placebo. And this is so it's a 16-week randomized placebo-controlled double-blind study, where, in addition to obviously looking at, the safety of our drug over that 16-week period, we're looking at the efficacy of the drug. So we want to see how different dose levels of our drug, how active are those dose levels relative to placebo. And so we're looking at a variety of different clinical measures that you typically look at, in AD, such as the EASI score and different variations of the EASI score, looking at pruritus, looking at impact on disease severity, on quality of life, on sleep, et cetera. And so what's important for us is, number one, to show that our drug has a significant impact compared to placebo. And number two, looking across these different doses that we're exploring and looking at safety and efficacy to ultimately choose one dose among those three doses to then bring into our subsequent phase 3 study. And those phase 3 studies would then be our so-called registration studies, the studies that we use to hopefully eventually get the drug approved. I mean, I think one thing important to mention is, how this drug, if it's successful, could change the proportion of patients with moderate to severe atopic dermatitis who actually use drugs like this. As I mentioned, dupilumab is a very active and effective drug, but one of the limitations is that only about 15% of patients with moderate to severe atopic dermatitis who are eligible to receive biologics actually go on to those drugs. And part of that is a reluctance on the part of maybe patients and physicians to go on to injectable drugs, or what it means to a patient if they have to go on to an injection, what it means to them psychologically in terms of the severity of their disease. And so our hope is that if we have an oral drug which eventually is able to show substantial activity and safety that's potentially comparable to Dupy, but now it's an oral drug, that this could make the drug available to many more patients, that many more patients with moderate to severe disease, and there are millions of such patients, right, who are not taking systemic therapy just because they're hesitant to go on injectables. If there now is a drug that patients might feel more comfortable going on to, that can really affect the root cause of their disease, of their inflammation, and help them, then we might have many more patients with moderate to severe atopic dermatitis who will actually go on to a therapy that really has a lot of potential to help them and hopefully transform their lives.